An anterior lumbar interbody fusion, abbreviated ALIF, all capitals, ALIF, is basically a lumbar spinal fusion option. And it's important to know this because the anterior approach to the spine is very different than the posterior approach to the lumbar spine. The advantages or indications for an anterior lumbar interbody fusion include the fact you have a better ability to restore the intervertebral disc height. It's well tolerated by the patient. It's superior for biomechanical low back pain, and it can indirectly decompress nerve roots. So plenty of medical advantages to the ALIF. If someone already had prior lumbar surgery posteriorly, and the surgeon does not want to fight scar tissue, then you can go from the anterior approach. And the converse is true. A surgeon can choose the anterior lumbar interbody approach if the patient already happened to have a previous lumbar operation, and if the surgeon wants to avoid the scar tissue and the distorted anatomy, it would be very prudent to use the anterior lumbar approach. The typical recovery after an anterior lumbar interbody fusion is approximately 3 months. We do the operation, which takes a couple hours. The patient stays 1 to 2 days in the hospital, sometimes goes home the same day. We see the patient at 1 month, 2 months, and 3 months after surgery with x-rays, and by the 3rd month, there's no restrictions. The patient can lift any amount the weights they used to. They can go back to work. They can drive a car. Essentially, everything goes back to normal at 3 months. However, at 6 weeks, that's when we do a little bit of physical therapy to iron out any of the kinks. And as far as off time from work, which is a common question, it's usually 6 weeks off of work. Very good results in general.